Okay, I'm washing my hands, knocking on the door. Good morning, Mr. Russell. My name is June, and I am a nurse practitioner student, and I'll be examining your head, eyes, ears, nose, and throat today. And if any time during this exam, if you feel any discomfort, please let me know.
Okay.
Okay, we're going to get started. So I'm going to assess your head, inspect, just looking for any bumps or bruises or lumps or anything like that. And I am looking at your hairline, which looks fine. Okay. And looking for evenness throughout your face. All right, good. Okay, and looking for any swelling. So now I'm going to palpate the shape and appearance of your head and your hair and your scalp. Okay, don't have any hair loss or lesions or anything. Okay, next I'm going to palpate your temporal artery here, which is 2+ and strong, so that's good. Now I would like you to open up your mouth, okay, and close it, and do it again, okay, and close it. Checking for some TMJ, and I don't really feel anything there.
Good.
Now I'm going to check your frontal and maxillary sinuses, so just let me know if you have any pain. Have any pain? Any pain? No?
No.
Okay. All right. And then I'm going to assess you for cranial nerve 5 motor and sensory function. So if you could clench your jaw. Okay. And now smile. Showing your teeth. Okay, good. All right. And I'd like you to close your eyes. And I'm going to test your face for some sensitivity. So this is soft and this is hard. I'm sorry, this is soft, this is sharp.
Okay.
So I'd like you to let me know what you feel when I touch each side of your face.
Soft. Hard. Soft. Hard.
Okay, good. Okay, now we're going to assess for the cranial nerve 7 function. So I'd like you to smile, frown, and puff out your cheeks, and put your pursed lips. Yes, very good. Okay, good. Everything's normal with that. Now I'm going to look at your eyes. I'm going to look at your eyelids. They look normal, and I don't see any swelling or any bumps or lumps. And now I like you to look up there. I'm looking for the color of your sclera. It's nice and white. Conjunctiva is pink. Don't see any lesions or drainage or anything, which is good. And then I'm also looking at your iris. The color is good. All right. And your lenses and your pupils. So now I would like you to look straight ahead at me, and I'm just going to check your pupillary response. Okay, and then this one. Good. Okay, now I want you to look straight ahead at me. And you can see the light shines in both of your pupils at the same time. Okay, good. Alrighty. Now, look ahead at me again. So I'm going to look here at this eye. Okay. Now while I shine this one again, and this one should also constrict at the same time. Okay. All right. Now I'd like you to look at my finger and look at the tip of my finger. Then I'd like you to look at the picture behind me. Good. Okay, look at my finger again, tip of my finger, and the picture behind me. Okay, good. Movement is equal and round and reactive. Great. Okay, now we're going to check for cranial nerve 3 and 4 and 6. So we're going to do the 6 cardinal positions of gaze. So I want you to follow my finger. Good. Now, just keep looking. Nope, just look straight ahead. Look at my finger. Good. All right. Okay. Now, I'm going to look in your eyes. And just look straight ahead. Okay, I'm going to take my glasses off. And I'm going to look using my right eye. And your right eye. And we're going to look for the red reflex. And follow it to the optic disc. And look in there, and I don't see any problems there. Okay, good. Now I'm just going to turn you a little ways over here. And look in your other eye. There we go. I need to open up, okay. And follow the red reflex to the optic disc. And don't see any abnormalities. Okay, good. All right. Next, I'm going to look in your ears. But first, I'm going to palpate your ears. Okay, tell me if this hurts at all.
No.
Any of this hurt? No? Okay. And then I'm just going to over here, checking for lumps or bumps, or any drainage or anything, or tenderness. None of this hurts? Okay. All right. Now I'm going to look in your ears. Pulling straight up and straight back. And I see, oops, the thing came off. Okay, look again here. We have a shiny pearly gray tympanic membrane with a good cone light reflex. Do not see any redness in the ear canal or cerumen. Now, look in the other one. Actually, go over here. Turn your head, please. And your whole body. There we go. Actually, I need you to turn. There we go. Okay, much better. All right. And same. So, pearly gray tympanic membrane with a good light cone reflex and ear canal. There is no edema or redness or cerumen. Looks good. Okay. Alrighty. Now I'm going to check a whisper test. So I would like you to plug one of your ears, and then I'm going to whisper a word to you, and I'd like you to repeat it to me. Apple.
Apple.
Okay, if you could change ears. Baseball.
Baseball.
Okay, good. All right. Next, I would like you to tell me if you can hear this equally on both sides.
Yes.
Okay, good. All right. Now, tell me if you can hear this.
Yes.
Okay, tell me when you don't hear it anymore.
Done.
Okay, good. I'm going to have you turn over this way in the chair. Very good. Oh, turn some more. Can you hear this?
Yes.
Okay, and tell me when it's done.
Done.
Okay, so this shows that air conduction is greater than bone conduction. That was that test. Okay, now I'm going to look at your nose. So I'm just going to palpate it to see if there's any lumps or bumps or anything. I don't feel any. And then I'm going to look inside your nose. If you just tilt your head back a little bit. Looking inside, I'm looking for any redness, swelling, or any drainage, and I don't see any, so that's good. Okay, so next we're going to test your smell, sense of smell. So if you could just occlude one of your nostrils with your finger, okay, close your eyes, and you can sniff this and tell me what you smell. Close your eyes.
Cinnamon.
Okay. Now if you could change nostrils, please. Okay, close your eyes and tell me what you smell.
Vanilla.
Great, good job. Okay, so next, that was testing cranial nerve 1 function. So next I'm going to look in your mouth, and I'm just going to use this as our tongue depressor. Okay, let's just look in your mouth, open wide, thank you. And look at your teeth all look good. I'm looking at hard palate, soft palate, okay. All right, you don't have any tonsils because those were removed. And let's see. I'm going to have you stick out your tongue. Just a second. And stick out your tongue. Okay, I'm looking that it's straight out and it's midline. And then if you could swallow. And then say ah.
Ah.
Okay, good. We're testing for cranial nerve IX, 10, and 12 function. Okay, now next I'm going to look at your neck. I'm looking for asymmetry and any enlargements, lumps, or bumps or anything, and I don't see anything there. Okay, now I am going to palpate your lymph nodes, and we're going to start with the preauricular, which is in front of the ears. Postauricular is behind the ears. And then occipital is behind your neck. Tonsillar right over here. And then we have the submandibular right here, and the submental right here. And then we have the superficial cervical, which is right in here. And then we have the posterior cervical. Okay. And the supraclavicular is right in here, and we don't feel anything. Okay, so now I'm going to look at your trachea. Seeing that it's midline, and yes it is, don't see any deviation there. And then I'm going to examine your thyroid. I'm going to step behind you. And I'm going to put my hands down here. If you could swallow, please. Okay, and I do not feel any enlargement of your thyroid glands.
Okay.
All right, so next, I'm going to assess cranial nerve 11 function. So I'm going to have you shrug your shoulders up and I'm going to press down. Okay, good. Now I want you to press against my hand. Okay, good. The other side. Okay, good. All right, and then we're going to measure for JVD. So I would have you lie down and I would measure and it's normal. Okay.